Welcome back to CTV Morning Live, joining Dr. Paul as we page Dr. Paul, and it was an easy topic today to figure out, especially as everything encompasses the Bell Let's Talk and talking about mental health. And for you could come right in with the numbers because it's stats and these are things that you're seeing.
Yes, we have statistics based on surveys, and we're looking at 20 to 30% of students that say they've been depressed or sad at one point. 20 to 30% of girls in grade 10 say that they've been bullied to the point where they've been depressed. And what strikes me is that a significant number of kids, 1% of kids, have actually attempted suicide to the point where they needed an emergency room or hospitalization. And so that, to me, tells us that, and that's a pattern that's actually increasing over the last 5 to 10 years. And that tells me that it's an emergency. We have to deal with mental health. I think that people talk to me about, you're a doctor, you talk about physical health when you talk about asthma and all these other conditions. And we kind of sort of don't talk about mental health openly as we should. And if people say, well, there's mental health and there's physical health, well, there's an interconnectivity between the two. So it's wellness overall. So when we talk about health and wellness, we really talk about mental health. And we also realize right now more and more that mental health itself was stigmatized, was poorly understood, was swept under the carpet and so on. But now we know more and more in many situations, depression and other anxiety disorders, that there are chemical imbalances. It's a medical condition in the brain. I mean, you can do different tests and CAT scans and PET scans and different levels of chemicals in the brain that show that there's an abnormality there as well. So it happens to be in the brain and it manifests itself as mental health. So people should really think about it. This is a serious problem and talk about it, especially in teens.
Well, I think it's kind of like, well, just fix it.
Yeah.
Well, let's just fix it. But it can't be fixed when there are things happening within the body and when there are chemicals. This is something that someone can't just say, well, today I'm going to be happy because I can be. That's not the case.
Deal with it.
Right.
You can't. So, and that's the problem. And the thing is that the other thing too is, if you've got a medical condition, in many situations you can actually examine it and say, oh, that's what you've got. You've got asthma or whatever. With mental health, it's kind of difficult to point down exactly what you have because there's a whole constellation of symptoms and processes that go into making a diagnosis. But once you have a diagnosis, there are things that can do. Yes, you can talk about it, you can have psychotherapy, and sometimes you may need medication. But the bottom line is you have to start the process. And as a parent, people ask me very often, well, what should I do to my kids? Well, be open with your kids. Look out for the signs of depression. If the child has a change in behavior, sleep patterns, eating patterns, schoolwork patterns and so on, be aware. The child won't come up to you and say, Mom, I'm depressed, or Mom, I've got mental health issues, but there will be signs.
Can I ask how young you start to see things? Because they're starting in school, 5, 6, they could feel like they're behind, they could feel like they're not making friends. I mean, this is a pattern that can start incredibly young.
It can start very young. In exceptional cases, we see young children with mental health issues. Most of the time, it peaks around adolescence. You see it more and more in adolescence, probably because it's a combination of hormonal factors and a lot of stressors that bring it out. And so some kids could live in an environment where they have mental health tendencies, but the environment is not conducive to it. Then they go to school, go to high school, and then and then you got hormones on top of that, and it's really a stressful time for them, so it brings it out. So I would say that usually it's more the older child or teen that's affected, although all parents should be aware of it at any age, obviously more as you go into the school age.
But there are factors, there are signs that as a parent, I mean, right now we're discussing the dialogue for people of any age right now to be able to come forth and talk about it and say, listen, this is something I'm going through. But at the other time, there are still parents who have to be the ones monitoring and looking for signs. Exactly,
and it's because even with adults, I mean, workforces, for example, workplaces have a lot of issues, and it's very hard even for their coworkers to cope with it. So and they don't even have the insight, and children, because they're immature and so on, don't have an insight that something's wrong, and they think it's normal. And so I think it's the parents and caregivers and family around that needs to be just astute and be aware. You don't have to be a psychiatrist or psychologist or medical expert. You know your child best as a parent.
You really do. Thank you for the information once again. Dr. Paul joining us, Medical Officer of Health in Eastern Ontario Health Unit, the CEO with that. And as we have been talking, it is the Bell Let's Talk Day. We've seen some wonderful response. I sent out a tweet. It was wonderful to see it retweeted. And that's the hashtag you need, Bell Let's Talk. You can send a text message, long distance call. 5 cents from each of those is going to be sent towards this day. We are raising funds. We are raising awareness for mental health.